And welcome to the news at 10. I'm Morgan Romero. COVID cases are increasing around the nation, and that includes here in Idaho. This uptick comes just before flu and RSV season typically starts as well. Abby Davis talked to state epidemiologists today. So Abby, what should people expect as we head into these cooler months?
Yeah, well, I'm told it's always hard to predict how severe a virus season will be. The two epidemiologists I talked with say these viruses are always around and they circulate at low levels until the timing is just right. Fall is almost here, and that means
typically it's the time of year where we start to see some pretty severe flu, COVID, and now RSV season is also approaching.
People are spending more time indoors, they're going back to school, they're not taking vacations, they're at work, and we are just in circumstances where it's more likely we're going to spread viruses amongst each other.
While Idaho hasn't quite hit flu or RSV season yet, state epidemiologists Catherine Turner and Christine Hahn say there's already an uptick of COVID-19.
As of last week, there were 80 Idahoans that were hospitalized with COVID-19, which was a lot higher than what we were seeing this summer.
It looks similar to some of the previous spikes that we've seen in the past, but it's still early. We don't know how bad it's going to get.
Turner says Idaho mainly tracks COVID through the number of hospitalizations and deaths. The state stopped tracking the number of cases in May after the federal government ended the national public health emergency.
Even when we were tracking cases before the public health emergency ended, the numbers didn't really mean anything because we were probably hearing about maybe a third to a half of actual cases out in the community.
Turner says that's because a lot of people tested at home and didn't report positive results.
What we really need to look at is trend. If there's more cases, there's going to be more hospitalizations. If there's less cases, there's going to be less hospitalizations.
As far as what flu and RSV season might look like this fall,
we did see in the southern hemisphere over our summer, their fall and winter flu season, that they had a pretty decent flu season and the vaccine worked well. So we're hopeful that the vaccines developed in the United States will also work very well this year.
Hahn says for a long time, adults really just had to worry about getting the seasonal flu shot. Now there are a lot more vaccines out there for the season. The Department of Health and Welfare does recommend getting the COVID vaccine, but Hahn says it's always a good idea for people to talk with their doctor about what's available and about what's best for them. Morgan.
Yeah, we've been talking about this for 3 years now. All right, Abby, thank you.